Hi everyone, welcome back to ADC Aspirants. I'm Dr. Henna. Today I've recorded a very special video for you all. All of you who are struggling with your OSCEs, struggling with time management or effective communication, or how to keep your answers very crisp and sharp, this is the video for you. I created a pretend scenario and I am the one presenting the case, and I'm also being the pretend patient here, who by the way is not very happy. So in this video, you will learn how to deal with various kind of, emotions that patients have and how to keep your time management very, very effective and how to deal with various other things when it comes to OSCEs. I hope this video helps you analyze where you are lacking and how you can overcome that. So have fun watching this video. Reach out to me if you have any questions and I would love to answer them for you. Thank you, and here you go. Thank you for being so cooperative while I was examining you, Mr. Smith. I'm sorry to see that you're in discomfort. Could you tell me a bit more about it? Yes, doctor. I had root canal treatment done just 3 days ago or 4 days ago, and I'm still in pain, and I wonder why. I don't think the pain has stopped, and it's just so annoying. It's continuous and it's affecting my daily life as well. All right, Mr. Smith. I did have a look and I've seen that you've got a root canal treatment done, and I did take an X-ray, and I would like to discuss my findings with you. But before I begin, could you just, help me by answering a few questions? Sure, doctor. All right. So you say that the root canal treatment was done 3 days ago. Now, the pain that you have right now, is it the same that you were feeling before the treatment was started? No. In fact, when my treatment began, I was in a lot of pain, but during the treatment, I had no pain at all. And suddenly, after the root canal was done, just a day later, I was numb on that day when it was completed. Just a day later than that, the pain came back. And it's not as severe as it was earlier. I understand. Could you tell me a bit more about this pain, Mr. Smith? The pain has been continuous. I've taken pain medications, but they haven't really helped. All right. What pain medications did you take? I took a Panadol here and there. I understand, Mr. Smith. Usually we recommend whenever you have pain which is continuous and if you're not able to get an appointment, it's better to take Panadol and Nurofen together only if Panadol is not sufficient. And you can take Panadol 1000 milligrams, which is 2 tablets together, plus Nurofen 400 milligrams, 2 tablets, 200 milligrams each, and take them together and repeat them after every 6 to 8 hours. Is that okay with you, Mr. Smith? Well, I hope I don't need them anymore. Yes, I will tell you all about why you may be having this pain. Again, after the root canal was completed, did you happen to take any precautions? Precautions? What kind of precautions? I wasn't given any precautions at all. All right. What I mean to say is, were you told not to eat from that side for a couple of days or not to use that side exclusively and use the other side? No, nothing of that sort was mentioned to me. I understand. So it means, have you been eating from that side regularly, Mr. Smith? Yes, of course. The day the root canal finished and the numbing wore off, I started eating everything from that side. All right, Mr. Smith. And anything that, apart from this, that you would like to add on, are there any changes in your medical history? No, everything else remains the same. But doctor, I have a question. Do you think the root canal has not been done appropriately? I think, I have a very strong feeling that the treatment done was very dodgy. I understand your concern, Mr. Smith. Usually, when you get a treatment completed, like a root canal especially, you try and think that it will get you out of pain and any sort of discomfort. But root canal is a very complex procedure which involves multiple appointments and it involves cleaning and shaping of all the areas which are very, very important for the successful outcome. Now, I have taken the X-ray and I would like to talk to you about that. Is that okay with you? Yes, all right. Tell me what's going on. There are various reasons why this pain may occur. Usually, after root canal, we do advise that the pain may be normal for the next, let's say, 24 to 48 hours or a couple of days more than that. And we do recommend not to use that side exclusively for at least a few days just because the tooth has undergone a lot of trauma. Well, like I said, I wasn't told anything. That dentist did not mention anything to me. I understand, Mr. Smith, and I'm sorry that you weren't given the precautions, but I will have a look. With your consent, I can request for the records from the dentist and have a look at, what was told to you after the treatment, and we can, discuss that for sure. All right, I can do that. The next reason why this tooth may be painful to you is if you have a look at this x-ray, Mr. Smith, I can see all the areas where the root filling has been done are appropriate except for one spot, which means that there is the root filling extending more than what it should be by just a few millimeters. What do you mean, doctor? Does that mean the root canal was not done appropriately? I wasn't even told anything about it. Do you think I should raise a complaint against the dentist? Well, Mr. Smith, this is actually a very difficult situation for me. Let me tell you that because I wasn't present in that scenario or that situation, I can't really comment on how the job was done. But sure, I can tell you what's really going on right now and what may be the possible reasons. If you would like to raise a concern, my strong advice would be to first seek an explanation from your treating dentist as to why it wasn't told to you or why this has happened. Like I said, root canal is a very complex procedure and there can be, missed canals, or there can be sometimes areas like blocked areas which cannot be completely filled. I can tell you about what I see. Does that answer your question, Mr. Smith? Well, okay, what needs to be done now, doctor? Well, based on what I see, this could be one of the reasons causing you pain because any filling which is beyond the root can be very irritating. And for that, we need to bring it back to the normal level. For that, I will have to numb you up, Mr. Smith, and redo that area which has been overfilled. And that will require a long appointment of around 45 minutes to an hour, and I can fix you that appointment really soon. Another option you have is to take some pain medications and get the treatment continued with your previous dentist. However, I see that your next appointment is 2 weeks later. I would recommend that you can get it done before that and you can continue with the rest of the treatment with your previous dentist. What are your thoughts, Mr. Smith? Well, I don't think I would like to go back to the dentist. I don't have a good feeling about him anymore. I understand, Mr. Smith. It's quite reasonable you feel that way. I leave that decision upon you and you can take your time to decide. The other things that I would like to check is what is going on with the rest of the teeth around the tooth which is painful. It could be the rest of the teeth as well. Maybe they have some decay underneath. And I have taken an x-ray. I would like to do my further investigations as well, like gently running my instrument around the other teeth as well and just tapping very gently to see if there's any pain from the rest of the areas and to check for any food lodgement around that. Do you have any of such problems at all, Mr. Smith? No, I don't have any sort of food lodgement. I'm pretty sure it's that tooth which is troubling me. All right, Mr. Smith. So, like I said, there could be few other reasons, like sometimes these teeth, which are the upper back teeth called as molars in our terms, they usually have 3 canals, and canals are the areas where our nerves sit. But mostly they could have more than 3 as well. 80% of the chances they have around 4 canals, and if one of them is missed, they could be one of the reasons why this pain is occurring as well. The other reasons could be some of these canals could be blocked, or there could be other small extra canals present as well. So based on all of this, Mr. Smith, we need to look into it under magnification, which I will be doing. However, if it is something that I cannot manage, I may have to refer you to a specialist called as an endodontist. Why a specialist? What is a specialist going to do here? Well, a specialist, they are more trained, they have more expertise, they use something called as a microscope for higher magnification for such complex procedures, Mr. Smith. However, there is a waiting time to see them, and also there is an extra charge. So I will refer you to a specialist only if I'm not able to manage this situation. And for the long term, I do recommend that you can get this treatment finished by getting a crown on top of a tooth, which does come with an extra cost, but it increases the long term future of your tooth because this falls under an area which is high chewing area for you. Do you have any other questions for me, Mr. Smith? Well, no, I just want to get this treatment done right now so you can get me out of the pain. Sure, Mr. Smith, I will start with the treatment. I'll write down a pain medication script for you and book you in with the next available appointment to get this problem sorted out. Thank you for trusting us. So I would like to talk about, the presentation that I made today and the OSCEs that I tried to show you how to deal with patients who are not very happy and who are upset about a previous treatment done, or even upset about some treatment which has been done by you previously. So in this case, you could see that the patient was a bit annoyed, he was a bit angry. But the most important thing is to acknowledge that. Using terms like, I'm sorry you feel that way, or I'm sorry to see you in pain. I'm sorry to see that you have discomfort in your upper right, upper left region, or whatever region that is. Acknowledging the patient's current condition is of extreme importance in such situations. No matter how good your content is, but if you're not reading the patient's body language well, it can do no benefit to you. The second thing that I would like to talk about is how you start your case. I've seen a lot of candidates, they're always in a rush. So sometimes when you have patients, this patient, Mr. Smith, wasn't like that. But if somebody comes to you holding their hand and sitting like this, and they say that I'm in so much pain, don't start off with your questionnaire straight away. Ask them, would you like me to give you some pain medication, or have you taken any recently? I'm sorry to see you in pain. Would you like to talk to me about it? So reading the patient's body language is of utmost importance. Not just this, when you have somebody who's very phobic, somebody who's not very happy coming to a dentist. Don't you hear that 90% of the times, I hate dentists? So people like those, try and understand what is their anxiety all about. Coming back to this scenario, taking an appropriate pain history, like what increases the pain or what causes it. In this case, Mr. Smith told me that he has been using this site ever since the root canal was completed, which meant that the tooth has been constantly traumatized with the forces, the occlusal forces, whereas it should have been this site, given some rest. Yes, the previous dentist did do, something called as over-obturation, as we know, which is explained in the scenario as well. But that doesn't mean that we start off our case by talking about it. Sometimes when we understand what's going on, we try to explain the first thing that we see. But in this scenario, Mr. Smith was already annoyed with his previous dentist who's done the root canal. Is it all right on our part to take that annoyance to another level by telling him the first reason that I would like to tell you the pain has occurred is because of this overextension or the over-obturation that I see on the x-ray? What would have happened? Mr. Smith would have just, been more angrier and said that I would like to now complain against that dentist because he did not give me precautions. I wasn't told anything about this and blah, blah. So do not do that. The code of conduct clearly states that if it comes to your colleagues, always try to protect. Do not say anything wrong or false to protect them, but try and get the patient to seek an explanation from the treating dentist himself as to why this was done. The next thing is always stating the correct amount of pain medication or the correct dosage of pain medication the patient has to take. It's always Panadol and Nurofen first, and if that's not able to control the pain, we go on to something like oxycodone. Now, I would like to talk about how important it is to manage your time and the number of times I've had to tell candidates to manage their time effectively and to make their explanations very sharp and concise. The maximum number of candidates fail to do that. And why? Because they go into technical aspects explaining various things which are not really relevant. For example, somebody would probably start talking about periapical infections or reinfections, or how this overextension is going to cause a lot of problem in the future. I would not do that in this current scenario, because I would like to finish my case by talking about the current situation and give a very small amount of time for the long term management or the long term treatment for this particular scenario. So manage your time with sharp explanations, concise and crisp answers that your examiners or your patients ask you with. Sometimes they might ask you, do you think this is wrong? Do you think this is right? Well, if you think it is right, say that. But if you think something is wrong, you can say it, but say it in a diplomatic manner. What are your thoughts? This is one of my favorite sentences to use. So when a patient asks you, should I go to and seek a referral right away? Should I go to a specialist right away? Should I wait for the x-ray to happen? And I'm talking about other cases as well. Talk about the pros and cons of that. For example, coming back to this case, when the patient said, when I was explaining that, we need to redo this one obturation which has been extended, and we can wait for 2 weeks. You may choose to go back to your previous dentist, or you may choose to get it done right now. I would recommend getting it done right now, because this is something which is going to irritate that area further on, right? So I've given him both the choices, which means that he can choose. Never give them one single option, because that's not the correct case, or that's not the correct way of communicating treatment options to the patient. Now, in the end, I would like to say this. We are all human beings. We do make mistakes. And when I finished the case, I realized that there were a few things that I missed out on. I may have missed out on the important rubric of what happens if I do nothing today. There will be an infection around the tooth may have to be removed in the future because it may cause you swelling and things like that. I did not talk about it. But would the patient have wanted that? He's come to me for some explanation, for a treatment, and I'm here to give him that. I also forgot to talk about one of the reasons for pain could also be incomplete debridement. Of course, I would not use that jargon, but I would talk to the patient saying that sometimes when we do root canal treatments, there are some areas which are not cleaned very efficiently or which are very difficult to access, which could be one of the reasons why this pain may be occurring at this moment. The third point I could not mention is when he asked me, what is a specialist going to do? I did say that they will use higher magnification, they are more trained and they have more expertise, but they also use something called as a CBCT. A CBCT is a 3D X-ray which helps us view the tooth in all 3 dimensions, rather than the 2 dimensions that I see on my X-ray over here. So even if I forgot to say all of these, at least my body language, my neutral tone of talking, I think that would make much more impact rather than these few pointers that we forget. So I hope this presentation helps you in understanding where you are lacking in your OSCEs and you're able to overcome that. Thank you for watching.